bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Many times on Comcast Newsmakers, we've spoken about autism. Of course, what to do? How do we know the early warning signs? The earlier we know, the better. Hello everyone, I'm Joe Basikia, and this is Comcast Newsmakers. Dr. Caroline Eggerding is with us. She's the Executive Vice President and Chief Medical Officer at Bancroft NeuroHealth, pioneers in doing so much for autism. Let's find out about those early signs. Good to see you.
It's good to be here.
It's very important to have you here because when we think of autism, the numbers are 1 in 150 nationally. You look at a state like New Jersey, 1 in 94
Correct.
Children. What does it mean to have autism, by the way?
Autism is a lifelong disability that includes difficulty with communication, difficulty with social interactions, and also a restricted set of interests or behaviors.
It's very, very simple for us to have this conversation, but some folks may want to know, what does it look like? How do you know when your child may be falling into these parameters? In fact, that may be a fair question. Looks aren't always the answer here, are they?
Looks are not always the answer. Often children with autism don't look as though they are typically developing. But when you spend a little time with a child or a toddler with autism, you recognize that they're having difficulty with communication, that their play skills might be different, that their ability to tolerate certain sensory experiences like sounds or like different touches are different, and that they're very much in their own world with a very limited repertoire of play activities. So they're not able to communicate with and interact with their family and with other children.
We may be giving a lot of panacea here to many parents, but of course this is something you parents, if you're a parent, you already know. You're thinking about this because of all that you've seen. But let's make sure that they know whether or not to panic about something or whether to look into something. Ages. Is there a certain age that they should be extremely alert to any changes?
Well, most children, the signs of autism are usually present by the age of 15 to 18 months. Certainly by the age of 3, these children really do present with some symptoms that are worrisome for parents.
And also, not to be clear about this too, there's so much hope.
Oh, absolutely.
And the sooner we find out, all the better.
The sooner we find out, the sooner we can start interventions, which really have been proven to be very effective in helping children learn to speak and also to be able to socialize and interact with their family.
By the age of 2, what should a child be able to do?
By the age of 2, a child should certainly be able to be speaking at least 2 words in very short sentences. In addition to speaking, though, the communication is so much broader than just, the words that a child has. They're also gesturing, they're also pointing for what they want, they're also joining with family members and with their little friends in shared play and shared attention.
Is there a point where everything seems to be going well, and then all of a sudden there's a dramatic change? Is that something to be looking out for? About
a quarter of all children with a diagnosis of autism seem to be developing normally, and then sometime, usually after the age of 12 months, they seem to stop, and sometimes they even have some language that they then lose. Other children seem to have difficulties from the time that they were infants. So it can be either.
What about sounds? We often hear about how sounds can be a real trigger mechanism.
Some children are very sensitive to sounds, and they may be very distressed by loud sounds. So you may see them putting their fingers in their ears or screaming. Some of that's also very typical reactions. So it really depends on the extent to which it interferes with their day.
And a wonderful point there too. While we may worry about certain situations, it's better to go look into them. It's nothing to get too worried about right from the get-go, because it may not be the situation of autism.
It's really important that if a family member has a concern, that they communicate that concern early to their primary health care provider, their pediatrician or family care doctor. There are screening tests for autism, and there are also diagnostic tests for autism. So you shouldn't worry. You should get intervention and help.
Especially with places like Bancroft NeuroHealth doing wonderful things, and thank you for that.
Thank you.
She is Dr. Caroline Eggerding, Executive Vice President and Chief Medical Officer at Bancroft NeuroHealth. I'm Joe Basikia. This has been seen on Comcast.